Did you know that up to 85% of type 2 diabetes cases could be reversed by eliminating 5 common foods from your diet? Unfortunately, most people continue consuming hidden sugars and refined carbs, unknowingly fueling insulin resistance and hyperglycemia. Today, we reveal which foods to stop now. Diabetes type 2 arises from chronic insulin resistance and a pancreatic beta cell dysfunction, leading to persistent hyperglycemia and a metabolic dysregulation. Diet plays a pivotal role. Certain foods exacerbate glycemic load and promote inflammation and impairs insulin signaling. Understanding how these dietary factors drive pathophysiology empowers targeted nutritional intervention to reverse disease progression in the most patients. Removing these foods can normalize glycemic control and reduce medications dependency. Beverages like sodas, energy drinks, and sweetened juices rank among the most significant dietary contributors to insulin resistance, delivering rapid glucose surge that overwhelm pancreatic beta cells and exacerbate metabolic dysfunction in diabetic worldwide. High fructose content in any beverages bypasses insulin regulation, is preferentially metabolized by the liver into triglycerides, stimulants the lipogenesis, and a visceral adiposity, process linked to impaired glycemic control and type 2 diabetes progression. Soft sugar drinks for water, unsweetened herbs tea, or carbonated water, infused with fresh citrus or berries. If you must indulge, limit sugar-sweetened beverages to no more than 240 ml once per week, and monitor your blood glucose after consumption. Processed meats, bacon, sausages, hot dogs, and deli cuts contain preservatives such as nitrates and high sodium with a saturated fat, leads that promotes insulin resistance, hypertension, and oxidative stress, leading to elevated diabetes risk in frequent consumers. Preservative nitrates convert to reactive nitrogen species, damaging endothelial cells. Sodium increases blood pressure and inflammation. Saturated fats impair insulin receptors function and increase free fatty acids that trigger chronic low-grade inflammation in a muscle adipose tissue. Replace processed meats with a grilled or baked lean protein, like a chicken breast, turkey, fish, or plant-based option. Aim for at least 4 servings. Unprocessed proteins each week to support healthy insulin function. Frequent consumption of deep fried foods, French fries, fried chicken, donuts, and introduces industrial trans fat, fatty acids, and oxidized lipids, impairing insulin receptor function, increasing systemic inflammation, and worsening glycemic variability in the people with diabetes. Trans fats integrate into cell membrane, altering membrane fluidity, disrupting insulin receptor binding, elevating LDL oxidation, and activating NFKB inflammatory pathways that collectively drive chronic insulin resistance and vascular damage in diabetic patients. Eliminate deep fried foods and packaged foods containing trans fat. Adopt cooking methods like baking, grilling, steaming, or air frying. Choose oils rich in unsaturated fats, olive, avocado, canola, and incorporate nuts and seeds for healthy, insulin-friendly fats. HFC is prevalent in sweetened beverages, condiments, processed snacks, and baked goods. Deliver free fructose and glucose in ratios that potentiate hepatic insulin resistance and lipogenesis, severely worsen metabolic control in diabetes. Hepatic metabolism of fructose phosphofructokinase regulation, leading to unregulated de novo lipogenesis, increased uric acid, elevated triglyceride storage, and improved insulin signaling, which contribute to non-alcoholic fatty liver disease. The glycemic dysregulation. Read labels to avoid HCS. Opt for whole foods. Opt for whole fruits, unsweetened yogurts, or small amounts of natural sweeteners, like stevia or erythritol. Incorporate species like cinnamon or vanilla extract for flavor. Limit total added sugars to below 25 grams per day. Excess refined carbohydrates intake. Diets dominated by refined grains, sugary beverages, and high glycemic index. Food triggers chronic hypoglycemia and hyperinsulinemia, leading to insulin receptors downregulation, fetal cell stress, and accumulation of advanced glycation in the products that impair vascular function and promotes type 2 diabetes progression, dramatically driving enormous healthcare burdens. Physical inactivity. Inadequate physical activity and a globally proven issue reduce skeletal muscle glucose uptake by lowering blood flow expression, diminish mitochondrial function, and disrupts AMP-activated protein kinase pathways, leading to worsened insulin sensitivity, increased adiposity, elevated inflammation, impaired endothelial function, and cardiovascular risk that collectively accelerate type 2 diabetes pathology and reduce quality of life. Eliminating sugar, sweetened drinks, refined grains, processed meats, fried foods, and HFCS can reverse up to 87% of type 2 diabetes caused by restoring insulin sensitivity and a metabolic balance. Implementing targeted lifestyle change and mindful nutrition empowers durable glycemic control. If this video helpful, like it and subscribe, and visit our channel. As always, consult your healthcare team before making major dietary shift to ensure safety.